Welcome, Mr. Shimon Eckhouse. Well, actually, we are in your booth. You're the developer and the inventor of this machine, if I was informed correctly.
Yeah, this machine was developed by Syneron Medical, and I'm the chairman and founder of Syneron Medical and one of the scientists working in the company.
So how many years have you been working with this type of machines?
For about 25 years now.
So this is not something developed yesterday. This has a long track record of safety and working well.
Absolutely. What this machine is a CO2 laser that has been used in medical application since the mid-70s. So it's about 40 years of experience.
So there's a lot of development in that. So why do people use CO2 lasers?
Well, what we did find out over the last 20 years is that the best way to get the skin to rejuvenate, to create new skin, is to create a very controlled injury in the skin. CO2 lasers is one of the best tools to create this injury.
So you say you create like a little lesion in the skin, and how does that work within the skin? What's the effect of that?
What happens is you create small wounds, small injuries, each of them less than 0.5 millimeter in diameter, and they are apart from each other. What happens is that the skin heals itself, and when it heals itself, it creates new collagen and new elastin. So in a way, rather than trying to force it from the outside, you naturally create new skin from the inside by creating this controlled injury.
Because it is a completely natural process, because if we wound ourselves, let's say by hunting or by just scratching our skin, we do the same. We generate a scar, but now the machine makes, as I can see on the drawing here, many small holes, as you say, 0.5 millimeters diameter, and then you get a complete resurfacing of the skin, right?
Correct. What we do, as we can see here on this pattern, we create a very small pattern, which is in this case about 10 by 10 millimeters. In each of it, we have close to 100 holes that we create in the skin. They are microscopic, so they heal very quickly. And when they heal, they create new skin. The beauty of it is that it is done, and the downtime to the patient is very minimal. You don't need to be out of work for more than 1 to 2 days when you do this kind of treatment.
So within 2 days, probably for women with a little bit of makeup, you can go back to work and nobody really sees something strange on your face.
Exactly. So what you have done is you rejuvenated the skin, you make the skin look much better, it looks brighter, tighter, it has much more collagen in it, which is a process that happens over a few weeks, but you can go back to work after 1 to 2 days.
Okay, well that's a serious improvement compared to the old CO2 lasers where you really took off the almost complete surface of the skin.
Exactly. That's the exact point. The exact point is that rather than taking off all of the skin, you create micro holes in the skin that heal immediately, but the longer term healing is what creates the rejuvenation. Short term, you don't have this downtime that you had with old lasers.
And probably also less risk for infections.
Less risk for infection, practically very limited pain. You can do it with no anesthesia if you want to. And as I said, you can go back to work after a very short time.
Okay, that must be a huge benefit. Now, how long after the treatment will it take for having the maximum benefit and really have this much younger looking skin?
You see after about 2 weeks significant improvement, but the process typically takes about 6 weeks to 2 months until you get the full benefit of this treatment.
Well, that's like the wound healing process that just takes much longer.
Exactly. This is what the body is doing. We cannot control that.
It's like breaking a leg. It will heal, but it takes a little while, and now we'll work on the skin because it's the same type of collagen actually.
Exactly. It's collagen that is growing back, but the nice thing about it is that this is fresh collagen the same way we had it when we were 18 years old.
Now I have a little bit more technical question, probably for the people watching the program. We also have something like the Hayflick limit. Now, by punching the small holes, does that have less effect on the Hayflick limit on the skin cells?
Well, what it really does is it penetrates deep enough to create an injury that is not seen so much on the surface of the skin, which is important for cosmetic reasons, but has enough of an impact to induce growth of new collagen.
Okay, so it does activate the fibroblasts in the deeper layers and they will move to the location. How deep does the laser penetrate the skin?
you in principle can control it, but typically we penetrate about 0.5 millimeter into the skin. We go through the epidermis, the upper layer of the skin, and do most of the work in the dermis itself. What you can see, for example, in this pattern here, which is the computer that controls this laser, is that you create both very narrow holes that go deeper into the dermis, but you also ablate the upper layer of the epidermis, which is the upper layer of the skin. So you get a combination of both getting the growth of new collagen, as well as the fact that you clean up the upper surface of the skin in one treatment.
So the wider blocks, as we can see here, is more to remove the hyperpigmentation, whereas the deeper ones activate the collagen reconstruction of the dermal layer.
Exactly. This is the way it is being done.
Okay, so this seems to be pretty new, this new pattern, right? Because before the strong CO2 lasers had also risk for hyperpigmentation with some people.
The biggest risk with the older lasers was the fact that when you remove the whole skin, this layer between the epidermis and the dermis grows melanocytes that grow melanin, that create hyperpigmentation, and you end up with probably new collagen inside, but what you see on the outside is dark spots, which was a very bad cosmetic effect. The beauty of this way of doing it is that the risk of hyperpigmentation is practically zero.
Okay. At what age should people think about using this? Is there any age minimum, or can it also be used for scar tissue?
Oh yes, you can get excellent results with scar tissue on any age with this product. What it does is it flattens out the scar, because the growth of the new collagen actually flattens out the skin. And more than that, we also see improvement in the pigmentation of the skin in the area of the scar. So it's very effective for scars. If you want to do it for general skin rejuvenation and for tightening of the skin, you could do it, typically people do it all the way from the age of 30 with no age limit. You can do it also on very old people.
Okay, and what about stretch marks? Because that's something women really don't like much after they're giving birth.
Stretch marks are a much more difficult problem to treat. We have clinical studies where we are using this device as well as other devices, but it's not perfect yet.
Okay. Any advices for them for another treatment?
Oh yes, we have lots of technologies for what we call body shaping. We have a unique ultrasound technology that melts fat non-invasively. We apply it to the skin and it breaks up fat cells. This is a new technology we are bringing to the market. We also have a very effective technology for tightening of the skin, which treats cellulite and also treats loose skin, which is a big problem with people that lose weight or women after they gave birth. This is called VelaShape technology, which is very effective for treatment of either young people, like women after giving birth, as well as older people, older women that have cellulite or have loose skin that they don't like.
So that's a different treatment, but that goes way deeper into the skin, way beyond the dermal layer, just like in the hypodermis.
Exactly. What it does is it goes all the way to the layers of underneath the skin, the hypodermis, and all the way into the fat itself.
Okay. Any other thing you really think we should know in the Netherlands?
The beauty is that what we have now in our hands are tools that enable you to get results which are, I wouldn't say the same, but comparable to what you can get with full surgery with zero downtime to the patient. And this we view as a great revolution.
Okay, well, I think many women will be invested in the Netherlands, probably men too. Thank you very much for your interview, and we hope you have a very interesting exhibition here.
Thank you very much. Thank you.